Good evening. You are tuning in to AWANI Tonight with me, Cynthia Ng. MCO is extended till February 18th. Are we due for new strategies? And managing COVID-19, are private hospitals prepared to step up? That's coming up. The Movement Control Order, MCO, which was to be enforced until February 4th, has been extended till February 18th. Senior Minister Datuk Sri Ismail Sabri Yaakob said all states except for Sarawak will be placed under MCO. The government, he said, has decided to extend the MCO after the Health Ministry reported that daily COVID-19 cases in all states remain high.
Stricter measures will be implemented, with Sabri giving an example of imposing limits on the number of people entering supermarkets. He said details will be released in due time, adding that the Attorney General was drafting new laws which would increase the fines for MCO violation. Interstate travel will not be allowed. In fact, Sabri said 31 clusters have emerged due to interstate travel. Meanwhile, he said SOPs for Chinese New Year celebrations is still being drafted.
Malaysia recorded 21 deaths from COVID-19 today, the highest death toll reported since the pandemic started. Now, this illustrates the importance of using the right strategy to minimize the spread and death toll from COVID-19. We spoke to former Health Minister Datuk Sri Dr. Zulkifli Ahmad for his insights.
But more importantly, I would like to remind the government that it's not just about extending MCOs after MCOs. It's about knowing what to do and how do you re-strategize, because you cannot be doing more of the same thing. More of the same thing, I don't want to quote Einstein here, but the fact that if we do not have, a fresh look and keep doing the same thing that we have been doing so far, we will not be getting, if you keep doing the same thing, you will definitely get the same result.
So here is what he would like to see.
Essentially, the strategy is you have got to, break that rate of spread of the viruses in the community by overcoming, by overcoming this rate of spread by your ability to outpace them. And you can only outpace them when you are in the position to do that with the number or the personnel, with technology, with rapid, testing, turnaround time, and isolating them early, and then of course treating them. And more importantly, is to ensure that we bring down.
Talking about re-strategizing, economist Dr. Jomo Kwame Sundaram said the treatment of the pandemic in Malaysia is still mostly left to the Prime Minister and Health Director General. It is time to take a more all-of-government approach and perhaps learning from examples set by other countries.
If you look at the world today, if you look at the countries which have been able to grow during the last year, during the year 2020, it is mainly countries in East Asia, because they managed to contain the contagion without resorting to stay in shelter lockdowns. In other words, commercial life, economic life very much continued while the population involved were mobilized to take precautionary measures. In Malaysia, we did take some precautionary measures, undoubtedly. This is important to recognize. But at the same time, I think we could have done much, much better as everybody now recognizes.
According to him, Malaysia could benefit from looking east.
Although we have the largest ever cabinet in the history of this country, okay, the cabinet was quite dysfunctional. There was no coherence in terms of the actions of the cabinet, and very often the whole treatment of the pandemic was left very much basically to the Prime Minister and to the Director General of Health. Very few other people were involved, except the Senior Minister for Defense, who also happened to take charge of security issues, and so was actually covering a lot of what the Ministry of Home Affairs was involved with. If you contrast this, for example, with Korea, with Japan, where public transport arrangements were radically transformed, work schedules were radically changed to ensure that there would not be too many people traveling in public transportation at the same time, to spread out the working day and so on and so forth. All this was done in many, many other countries, but instead of looking east, we were looking west.
That is about managing the MCO, but let's talk about managing the current COVID cases we are facing. Earlier, the government announced an allocation of 100 million ringgit for private hospitals to help ease the pressure faced by the public healthcare system in battling the pandemic. Many private hospitals have already agreed to take patients from government hospitals. But how will this collaboration look like, and just how prepared are private hospitals in managing a highly infectious disease? Saraya Mia has the story.
The main concern that private hospitals have in accepting COVID-19 patients are due to their capacity and capabilities.
Okay, private hospitals are not built the way public hospitals are built. In a private hospital, the capacity and the capability is based on our needs. We do not have the same type of manpower like what you would see in a public hospital. They have got lots of specialists, a lot of house officers, a lot of medical officers, because there are a lot of other issues infrastructurally that we need to look in a private hospital, the airflow, the flow of patients, because we were never designed in looking at very highly infectious disease, because usually highly infectious diseases like this are managed normally by public hospitals. So we can do it, but we have to do it in very, very controlled measures.
All COVID patients sent to Sungai Buloh, sent to the 52 hospitals, including UKM and UM. This was a brilliant move, and that is why we are doing very, very well with a case fatality of 0.4%. Why fix if it's not broken?
Dr. Musa further explains a large portion of ventilators at government hospitals are used on non-COVID patients. Decanting them to private hospitals would increase its capacity to focus on COVID patients. And now that the Ministry of Health has finally agreed to allow home isolation, Musa views that this itself would free a large percentage of COVID beds.
There are 6,774 beds, dedicated for COVID. And the occupancy rate was 64%. And 70% of the beds were taken up by type 1 and type 2 cases. If you decongest even 50% of your category 1 and 2, you're down to 30% occupancy rate. Then it relieves our doctors, isn't it? They can dedicate themselves to category 3, 4, 5. You get better outcomes. And of course, they are not exposed to patients. So less infection in our healthcare workers. Yeah. And now you see many healthcare workers because they're looking after category 1, category 2, right up to category 5.
Private hospitals say they are not closing the doors to COVID-19 patients from the government, whether it is now or later, but they are concerned about how they can cope with the volumes of COVID-19 patients.
In anticipation of potential sort of further increase in numbers and anticipating if that happens, that the system will not be able to cope with current capacity, we are also potentially looking at converting 2 of our hospitals, one in the Klang Valley and one in Johor, to be converted into what I call a full COVID-19 ready facilities, where these 2 locations can actually even take up cases to category 5, which is essentially those patients who are ventilated and in ICU care.
How best to battle the pandemic? This has been the ongoing conversation between the public and private healthcare providers, and it appears that the government is listening to them.
Finance Minister Tengku Datuk Seri Zafrul, when announcing measures to beef up public health earlier today, said that apart from procuring vaccines and having a detailed plan on national immunisation, the government is looking to get private hospitals to take on non-COVID patients. The government is also adding more support staff. Recently, he said, the Health Ministry employed over 3,500 new medical personnel to relieve pressure at the front lines. This is part of efforts under the 2021 budget and Permai package.
We'll take a short break. Stay with us. Welcome back to AWANI tonight. We are staying on the subject of COVID-19, more specifically vaccines. The Pakatan Harapan Immunization Task Force today expressed their concerns over the European Union's export controls on COVID-19 vaccines that could potentially affect Malaysia. Task Force Chairman Datuk Sri Dr. Zulkifli Ahmad urged Putrajaya to come forward and explain the situation to the people.
So surely this is a matter of concern, but I would, these are, of course, factors beyond our control, right? But there again, the government must, take ownership and responsibility to explain, to our citizenry, to our rakyat, so that we know, what to expect, right? And what maybe I'm also concerned is not so much of, besides those that is beyond us, are the delays that would also be, as a result of our own glitches and our own shortcomings, and that certainly would not be, excusable, or it is inexcusable if that is to happen. Yeah.
Meanwhile, responding to these concerns, Minister of Science, Technology and Innovation Khairi Jamaluddin said discussions were made with both ambassadors from EU and Belgium have given their assurances that the advance purchase agreement with Pfizer will be fulfilled upon Pfizer applying for export authorization, and the vaccines will be delivered on schedule beginning this month. According to Khairi, this means that the COVID-19 immunization plan is expected to proceed according to plan. Both the EU and Belgian embassies to Malaysia will release statements regarding these supply assurances.
On to other local stories, 7 NGOs, including Bersih 2.0, filed a summon against Prime Minister Tan Sri Muhyiddin Yassin and the Perikatan Nasional Government today, challenging the emergency ordinance.
In a press conference held online this afternoon, lawyer Edmund Bond said the originating summons was a landmark suit, as for the first time civil society groups had gathered to sue the government on the emergency proclamation. Bersih Chairman Thomas Fan said they are concerned that the proclamation of emergency and the emergency ordinance have resulted in both houses of parliament being unable to fulfill their constitutional role of debating and voting on the emergency ordinance.
Moving on to major stories on the international front.
The United States under President Joe Biden has threatened to reinstate sanctions on Myanmar after the latest coup by the military. The sanctions on Myanmar had only recently been lifted as the country was beginning to emerge from the decades-long military rule. Meanwhile, the military instructed airlines to suspend all flights until April 30th, an extension of travel restrictions put in place by the previous government to contain the spread of COVID-19. Chinese authorities have confiscated over 3,000 fake doses of COVID-19 vaccine as part of a campaign to combat vaccine-related crimes in the country since last September. State news agency Xinhua reported over 80 suspects were arrested. The fake vaccines were made by injecting saline into syringes. Suspect may have intended to send the vaccines abroad.
That is all we have for you on AWANI tonight. Coming up in just a minute, Consider This will focus on our efforts to address Malaysia's drop in the rankings by Transparency International Corruption Perception Index (CPI) for 2020. Thank you for watching. I am Cynthia Ng. We'll see you tomorrow night.